The number of deaths due to chronic obstructive pulmonary disease, COPD, has increased in Delhi over the last few years. In 2022-23 alone, deaths due to COPD increased 9 times as compared to the last 7 years. Chronic obstructive pulmonary disease, COPD. COPD is a common lung disease. It is also called emphysema or chronic bronchitis. Emphysema refers to destruction of the tiny air sacs at the end of the airways in the lungs. Chronic bronchitis refers to a chronic cough, with the production of phlegm resulting from inflammation in the airways. COPD and asthma share common symptoms: cough, wheeze, and difficulty breathing, and people may have both conditions. COPD patients witness restricted airflow to the lungs and other breathing problems. Causes: smoking and air pollution are the most common causes of COPD. In COPD patients, the lungs can get damaged or clogged with phlegm. Symptoms of COPD. Symptoms are an cough, sometimes with phlegm, difficulty in breathing, wheezing, tiredness. People with COPD are at higher risk of other health issues. COPD is not curable, but the symptoms can improve if one avoids smoking as well as exposure to air pollution and gets vaccinated to prevent further infections. Medications for improvement of COPD. Medicines, oxygen therapy, and pulmonary rehabilitation. COPD trends. 2022-2023 saw the highest number of deaths, 886. The number of deaths in the last 7 years did not exceed 150. In 2015-2016, 181 deaths. In 2016-2017, 98 deaths. In 2017-2018, 111 deaths. In 2018-2019, 55 deaths. In 2019-2020, 98 deaths. In 2020-2021, 62 deaths. In 2021-2022, 125 deaths. As per the data provided by Directorate General of Health Services in an RTI query, chronic obstructive pulmonary disease, COPD, as per World Health Organization, WHO, chronic obstructive pulmonary disease, COPD, is the third leading cause of death in the world, causing 3.23 million deaths in 2019. Approx. 90% of the global COPD deaths of people under 70 years of age occur in low and middle income countries, LMIC. In high income countries, tobacco smoking accounts for over 70% of COPD cases. In LMICs, tobacco smoking accounts for 30-40% of COPD cases, and household air pollution is a major risk factor. COPD is included in the WHO Global Action Plan for the Prevention and Control of Non-Communicable Diseases, NCD, and the United Nations 2030 Agenda for Sustainable Development. The WHO Package of Essential Non-Communicable Disease Interventions, PEN, was developed to help improve NCD management in primary healthcare in low-resource settings. Framework Convention on Tobacco Control is enabling progress in this area, as are WHO initiatives such as MP, OWER, and tobacco cessation to curb tobacco smoking, air pollution, and COPD. The data of the number of the deaths comes at the time when Delhi recorded the most polluted December in 2023 compared to last 4 years. As per the medical science, there is a clear link between COPD and long-term exposure to air pollution apart from smoking. People exposed to pollutants like PM2.5 will damage to the bronchi and alveoli. As per a study published in 2019 in JAMA Network Journals, long-term exposure to ambient air pollutants was significantly associated with increasing emphysema. Emphysema is one of the diseases that comprise COPD. A study published in Lancet in 2022 said long-term exposure to air pollution was associated with an increased risk of COPD, especially in those with high genetic risk and unfavorable lifestyles. Also, women who are exposed to indoor pollutants, such as biomass and coal, during cooking, tend to develop COPD even without smoking.